Good morning and welcome to today's webinar, Employee Benefits Healthcare Trend Insights. My name is Michelle Wilcox and I will be your moderator today. I will also be monitoring questions you may have during the session. Before we open up the session, let's review a couple of key items. All of the webinar materials we discussed can be found at the URL currently showing on your screen. I will be sharing this URL in a follow-up email, so don't feel like you need to write it down right now. If you have trouble with your internet connection during the webinar, we recommend leaving the presentation and logging back in. We do not control the audio, your devices control your audio. So if you have audio difficulties, try adjusting the volume settings on your device. If a telephone line goes down during the call, hang up and call back again at the same number. If all lines go dead, watch the on-screen chat box for an alternative call-in number. Feel free to ask questions or provide feedback by using the questions box during the webinar. If you are using a tablet, you may need to tap on the screen for the options bar to appear. Then you can select the appropriate option. We may not respond immediately, but we will work your questions or feedback into the presentation. If we can't get to your comment or question during the session, we will be online afterwards to respond, or we may follow up in an email if we run completely out of time. You may also email us at moderator@aspenrmg.com for up to 48 hours after the webinar. This will be a 1-hour presentation. Questions and comments are very much encouraged throughout, and the presenter will be answering questions at the end. And lastly, we have a number of upcoming webinars covering a variety of topics, including those listed on the Heffernan webinar website. With that, let's begin today's webinar. Our presenter today is Jennifer Coyle. Jennifer began her career in employee benefits over 25 years ago after receiving her bachelor's in economics and international relations from Cornell University. Jenny joined Heffernan Insurance Brokers in March of 2012 as a technical analyst to assist the Northern California Services team in underwriting functions. In January 2014, she expanded her role to manage the employee benefits underwriting division for Heffernan nationwide. Jenny is passionate about helping companies lower costs while providing an employee benefits program that will retain and attract top talent by developing tools, resources, and training programs for our exceptional Heffernan teams to deliver these objectives directly to their clients. And with that, I'm going to go ahead, Jenny, and turn the presentation over to you.
Thank you very much, Michelle.
And I'll let you know. Okay, looks good.
All right, great. So welcome everyone to the Employee Benefits Healthcare Trend Insights webinar. In today's webinar, we're really going to be focusing on the results of Heffernan Benefit Advisory Services 15th Annual Trend Report. This report was released last week and can be found on Heffernan's website. In the first half of our report, Heffernan surveys the medical, dental, and vision carriers throughout the United States to get the trend projections that will be used in the employer group's upcoming renewals. All of the carriers' results are aggregated into projected trends for 34 different states encompassing 5 different geographic regions. So we'll go through the trend projections for these 5 regions. The second half of the report looks at what is going on in the healthcare industry to understand what is driving trend and also the demands of employers on the benefits that they offer their employees. First, we're going to look at what is trend and why do we track it. We really want to make sure that we define trend and understand why it is so important. So trend is roughly or loosely defined as the expected increase in the cost for medical goods and services. This is really just the medical inflation or how much the cost for medical services is going to cost in the next year. The trend is used to develop rates or premiums. Both fully insured and self-funded products all look at trend estimates when they are developing and projecting their costs for the upcoming year. It also affects products of all sizes. So whether you are in a small market, a mid-market, large group, self-funded with thousands of employees, trend is the key factor that really predicts what your costs are going to be. However, it is not the same as a renewal increase. So while it's the driving force of what causes what that increase might be to an employer, it is not the only thing. So it gives us an idea of where costs are going, but it is not the same as the renewal increase that you'll get each year. Trend can vary significantly between carriers and regions because it takes each carrier is going to look at the portfolio of plans that they have. So whether or not they are mostly an HMO, a PPO, if they have HSA and HRA plans in their portfolio, what the provider costs are in the regions where they have the most number of members in their plans. And utilization trends are going to be different across the country and all over. And all of these mean that we are going to see different trend projections from the same carriers in different areas, and different carriers in the same area are going to have different trend projections. So we survey a wide variety of carriers in order to aggregate them and really get a sense of what is going on in each of our key markets. So as I mentioned earlier, we do look at our results in 5 key regions. The first region we're going to look at is the West region. In our report, we call out specifically the trends for Alaska, California, Montana, Oregon, and Washington. Alaska and Montana are new to our report this year. And then we also look at all of the trends for all of the states, not just the ones specifically called out, and look at what's going on in the Western region. Overall, the trend projection for the West in 2025 is higher than what we were seeing in 2024. However, the West does have the highest percentage of employees that are enrolled in HMO plans, and the 2025 HMO trend projections are a little bit lower than the 2024 trend projections. So while you might be seeing high costs or trend projections overall in the West, know that for those in HMO plans, you might be seeing something a little bit lower. But while there is the highest amount of HMO concentration in the West, there's still a significant amount of PPO and CDHP plans. CDHP are consumer-driven health plans and are plans like HSAs and HRA plans. Those first 3 products that we show here are really the key plans. We only have small populations throughout the United States that have POS and indemnity plans in place. And we look at all of the trends combined with RX to really look at what the total plan costs are going to be, and not just medical and RX separately. So in the West, the trend projections for PPO and CDHP plans are unfortunately a little bit higher than they were in 2024, and they were significant in 2024. What we're seeing is really that the inflationary pressures that we saw in 2024 are really still continuing in 2025. Moving on to the Southwest region, this region isn't large in the number of states, but geographically covers a wide area. In this region, we call out Arizona, Colorado, New Mexico, and Texas. The results in the Southwest region really vary across the board. Both Arizona and Texas are seeing higher trend projections for all their products in 2025 than they were in 2024, while Colorado is seeing lower trend projections for HMO and CDHP plans, and New Mexico is projecting lower trends for PPO and CDHP plans. In the Midwest, covers a few more states. We have several new states that we're looking at this year. The prior report only showed Illinois and Missouri. We've added Indiana, Kansas, Nebraska, and Ohio to this year's trend reports. And then we're looking at the Midwest in total. The inflationary pressures that we're seeing across the region are carrying over into the Midwest region as well. 2025 trends in the Midwest are higher than what they were in 2024. And a lot of this, and this is true really for all the regions, is being driven by prescription drug costs. They're rising much faster than the overall medical costs, and we'll talk a lot about this a little bit later in the presentation. But prescription drug costs are projected to rise nearly 5 percentage points more than in the prior year. And in all regions, higher drug costs are the leading driver of the projected insurance costs. But not only are the drug costs increasing, but they also represent an increasingly higher percentage of total medical expenditures. As more things are being treated by prescription drugs, they represent a higher percentage of total costs. Moving on to our fourth region here in the Northeast. Opposite of the Southwest, it's not as large of a geographic area, but does encompass a large number of states. We call out many of them within this report. Overall, the Northeast is seeing a significant increase from the prior year. It's up to about 9.2% on average. Massachusetts is projected to see the largest medical cost increase, while New Jersey is projected to see the lowest. However, unlike other regions where we're seeing a variance between the different products, it's a lot more uniform in the Northeast, with trends going up for HMOs and PPOs kind of in a similar fashion. You're actually seeing some of the same numbers, across products in this Northeast region. And then the last region that we are looking at is the Southeast region here. In this report, we've added a significant number of new states in this year's report. And unlike other regions, the trend projection for 2025 for the Southeast is the same as what it was for 2024. So while that number is high at 8.5%, it is not higher than what employers located in this area were seeing last year. The highest projected costs increase are in West Virginia, and the lowest are in Arkansas. And next year's cost trends for HMO plans are somewhat higher than what we're seeing for PPO and CDHP plans. So looking at all these results on a national basis, you can see kind of the blended increase when we take their product portfolio and mix. So the higher HMO utilization in the West, with the lower HMO utilizations in some of the other regions, we get an overall medical and RX trend for each of these regions. We're seeing a much bigger variance than we saw last year, with a low of 8.5% in the Southeast and a high of 9.5% in the West. And national medical trend is 9%, whereas that number was 8.5% last year. You may have been seeing some recent information about projected medical costs going up to 8% this year. And I want to keep in mind that these are trend projections, and that is different than what your actual end of the day employer costs are. So these are where the costs are predicted to go to, but what an employer, again, actually sees as an increase, particularly after they might make some plan design changes or mixes in their plan offerings, might be different as well. And so here we've been mostly focusing on medical because it does have the biggest impact on our groups, but we also look at dental and vision trends. Historically, dental and vision have been not as significant as medical, and the increases are a lot more nuanced. So you don't really see the highs and lows that you might see in the medical plans. But also they're much more in line with national inflation rates for all industries. However, across all the different types of dental plans, dental HMOs, PPOs, indemnity plans, we are projecting to see a little slight uptick in 2025 than we saw in prior years. And vision was pretty consistent the last couple years. And once again, we're seeing a spike there in our vision trends. So those numbers, there's a lot more detail in the trend report. So that's a summary of that. I really now want to take a look at the self-funded market. High trend increases year over year have really led to growth in the stop loss market because it allows employers to better control costs and really directly feel the results of their cost saving measures. So we have seen more employers exploring self-funded options. And also as a result, the self-funded or the stop loss carriers and our traditional carriers are offering more alternative funding products such as captives and level funded products to allow smaller employers opportunities to self-fund. So you'll see increased ways to provide self-funded options to employers. And the reason for that is while the inflation and trend equally affects fully insured and self-funded markets, what an employer does and some of the cost saving opportunities that they put in play on a self-funded plan have a more direct and a more immediate result on their costs. So all of these opportunities that I just kind of showed up before, such as on-site clinics, wellness programs, value-based payment options, are all going to help lower costs. But if you're self-funded, you will see these in lower claims immediately, whereas it will help the fully insured industry as a whole to bring down the costs. But when you're fully insured, you pay premiums and they're set through the year. So you might have a slightly better renewal with some of these plans, but you're not going to see the immediate effects on that. And so with that, the self-funded market really is growing. But at the same time, we are also seeing a really significant rise in million-dollar claims. So when you do move to self-funded, it just becomes more important to be aware of some of the risks. There is stop loss insurance that limits the group's liabilities, but we also have to keep in mind that claims are getting more and more expensive. So looking at these charts here, we're showing the odds of having $1 million claim or a $2 million claim. And we're looking at 3 time periods. So the first one is 2013, and that's before the Affordable Care Act. Before ACA was implemented, plans often had annual or lifetime maximums that were built in their plan designs that limited the liability. So we're also then showing 2014, right after ACA came into play, to see how that affected the million dollar claims, and then looking really at the present. So it's obvious the increases that you see for a group with 5,000, but I want to call out the numbers for an employer group that has about 500 employees. So pre-ACA, a group with 500 employees had a 1 in 110 chance of having $1 million claim, and a 1 in 1,373 chance of having a $2 million claim. In the following year, after ACA, that expectation for that 500 life group went for having $1 million claim from 1 in 110 to 1 in 68. And of a $2 million claim, it went to 1 in 569. Now, there haven't been any rules that have changed the likelihood or how plans have to have claims. So 10 years later, the odds for that 500 life group So today, of having $1 million claim is 1 in 26. And that has increased to 1 in 95 of having a $2 million claim. What causes a claim to hit $1 million? There are lots of conditions that can be $1 million, but there's very few that are in and of themselves just cost $1 million. Most of these, the average cost might be on average maybe $250,000 or $300,000, but if there are really long inpatient hospital stays, comorbidities, complicated surgeries, or some high cost drugs involved, those are the reasons that a standard claim might get to this $1 million or $2 million range. Surveying a lot of stop loss carriers where their business is to protect, employers from these really large claims, the conditions that are most likely or most commonly turn into $1 million claims are cancers with malignant neoplasms, cancers with a leukemia or lymphoma diagnosis, cardiovascular disease, musculoskeletal connective tissue conditions, and perinatal and neonatal care. We want employers to be aware of these conditions because it's really important that disease management programs are put into place, because all of these conditions do not necessarily need to become $1 million claims. So the more that you have something to prevent long inpatient hospital stays or other conditions for developing as a result of these, the better you have at keeping those claims from escalating. The next thing that we are going to focus is something that I hinted at earlier, is that specialty pharmacy or drug costs are really a primary driver of what we're seeing in our trend increases today. Specialty drugs are used by a very small percentage of the population. It's 4 to 5%, but they represent 60% of the total drug spend and 19% of total health expenditures. So those aren't the drugs, the antibiotics and all those are these really high cost drugs. And if you look at the drug pipeline, so the new drugs that are approved year over year, these are not a small shifting in the formularies, but drugs that are completely new entities or a growing class of drugs or new biologics. Those are the orange ones there. If you look at 2003 versus 2023, you can just see how much drug that this pipeline really has grown, particularly with those biologics there. To get an idea of how much some of these specialty drugs can cost, here is a list of the 5 most expensive drugs in the US. All 5 of these were approved and released in the last 18 months. The good news is that these drugs, all 5 of these drugs listed, are one-time, one-dose treatments that are either a curative or can really greatly enhance or prolong the life for some of these exceedingly rare, extremely expensive diseases. And so this is just something to be aware of, making sure that you do have stop loss protection if you are self-funded to cover drugs in your plan and not just medical. So some really large dollars there on the prescription. And the other thing, you can't talk about the rise of pharmacy costs without really looking at GLP-1s. And really the poster child for GLP-1s is Ozempic. So the social media and celebrity usage of this drug has really created a viral demand for Ozempic for weight loss. So Ozempic's been around since 2005 as a treatment for type 2 diabetes. But over the last couple of years, it has been noticed that it does have the effect of causing weight loss. And so we have seen surging sales of this drug, both on and off label. Ozempic is really the umbrella name for all of the GLP-1s, but that's not really what's being taken for weight loss. Here we have the two primary manufacturers of GLP-1s within the US. Ozempic is manufactured by Novo Nordisk, and the other competitor is Mounjaro, and it's manufactured by Eli Lilly and Company. You can see that the leading ingredient is a little bit different. So all of these drugs are under patent and will be for for a good amount of time still. And they do have slightly different ingredients, and that's why you're seeing these. So they have a different GLP-1 that makes them up, but there's not enough yet to have competition that might drive down. Ozempics are diagnosed for type 2 diabetes. Wegovy is the same drug made by the same manufacturer, same ingredients, and it's the exact same formulary that's made up, but that's used for chronic weight management. And you can see that the cost for that is $1,349.02. I will say that the amount that you're getting is a little bit different for weight loss purposes than for the type 2 diabetes. So it's not just the relabeling of the usage that's driving that cost, but you can see the difference between the drug as prescribed for diabetes and the increase for when those corresponding drugs are used for chronic weight management. Rising obesity and employee demand force many employers to include GLP-1s for weight loss despite the high costs. So if not properly managed, they can have a really significant impact on an employer group's bottom line and could cause better long-term health outcomes. So really, our trend report does really explore the fact that these drugs are being offered, and there's a large percentage of the population that can benefit from these. But if even a small percentage of the eligibles were to be on some of these drugs for weight loss and chronic weight management, it has a huge impact on an employer's bottom line. But employees are really pushing to cover these drugs, and it could be that it will lower costs in the long run. And so we just want to make sure that our groups are really aware of the usage of these drugs on the plan and how that's affecting costs. So the next thing that we really want to look at is really generic drugs and biosimilar drugs. And I'll go through another example of how these come into play, but everyone knows that generic drugs are the same active ingredients as brand name drugs and that they really lower cost. If you're taking a generic drug, not only is it lower costing for you at the pharmacy, but so less out of your pocket, but they also cost the plan, so the employers, the carriers, 80 to 85% less than the brand name equivalent. With the increasing number of biologic drugs on the market, biologic drugs are made out of living organisms, and so the generic equivalent to a biologic drug is a biosimilar. They're lower priced alternatives, and they're very similar to a biologic drug, but they're not exactly the same. And to be called a biosimilar, they have to have no clinical or meaningful difference in terms of safety or efficacy, but they also are still expensive to produce, not as expensive as the biologic. You're not seeing the huge savings that you would see for generics, but they do offer some significant savings if more people were to adopt and use them. And so really, to kind of tell this story, we really want to look at Humira. So Humira is the top selling drug in the world. It's made about 200 billion. Its original patent expiration date was 2016, but it didn't come off patent until 2023. The price rose 30 times during its time under patent, and most notably after 2016, when there was a number of legal cases that really challenged and prevented it for other drugs from coming onto the market. It is a biologic drug, and so the first biosimilar, I don't know if I'm pronouncing this drug name correctly, but Angevita, hit the market in January of 2023. And 8 months later, or 6 months later, 8 more biosimilars hit the market. However, by October of 2023, Amgevita had only sold 23 million in sales, and Humira still had 9.4 billion. So even though there were 9 options or biosimilars on the market, Humira still managed to have a really strong hold on that market. So what happened? Why wasn't there more adoption of all of these biosimilars? And the first is that physicians were not wanting to modify a course of treatment. So Humira had, over 20 years of exclusivity. If people were taking it, it was successful. A physician wasn't incentivized to say, why don't you take this other drug, because it's the same thing but might just be a little bit cheaper. There was no reason that physicians were really looking to modify the course of treatment. But another reason is that Humira was still getting preferential treatment on formularies. The PBMs were really slow to update, and so even though the biologics were technically less expensive than Humira, there were still big rebates that were coming for Humira, and it was still being classified as a preferred drug. And so when pharmacists would go to fill, they weren't encouraging members to really switch to take a lower costing biologic. We're starting to see that the Humira is losing a little bit more of its foothold. PBMs are adjusting their formularies. Some of the biologics are now being promoted over others. And we're hopeful that maybe that in the future, as more of these big brand name drugs do come off market, that the PBMs will react quicker to the biosimilars that are there to help bring costs down. But it's worth being aware of the big names that are coming off patent to encourage members to really ask about these drugs. They will save money on the costs, and the plans will save money too. The next driving force on pharmacy costs is really the huge uptake of cell and gene therapy. It's a really new science, and in the past, most cell and gene therapy drugs have been for cancer treatments. But we're seeing new approvals for hemophilia, sickle cell disease, and other conditions. So you'll be seeing a lot more of cell and gene therapy. And looking at this chart here of, kind of the expected costs, there's a lot more of these really life-saving, life-altering drugs that are going to be coming down. But they are really very expensive to manufacture and come at a very high price point. It costs about 5 times more to develop a cell and gene therapy drug than a traditional drug. And the reason for that is one, it's very new treatment or very new technology, and there's a shortage of skilled workers that know how to develop and manufacture these drugs. The process is very complicated and very intricate, and so it can only be produced in small quantities. And as a result, the demand for cell and gene therapy is really outpacing the supply. So all of these stories, I guess, that I've been telling about cell and gene therapy, the rise of GLP-1s, the lack of quick adoption to biosimilar are all, examples of why specialty pharmacy is really driving costs and driving trend, not just this year, but in the last couple of years too. The next focus that we're going to look at is really the kind of the tension between these rising healthcare costs and employee satisfaction. So as costs are continuing to escalate, the key drivers were the same as last year. So inflation, there's a shortage of medical providers, and then of course the specialty drug costs are really pushing and driving medical claims up. The health insurance market is slower to react to inflationary pressure. And so the reason for that is premiums are set a year in advance, but not just that, but how providers are compensated for their services are really set in long-term contracts. And what we're seeing is right now, more carriers are negotiating with the providers, and because of shortage of medical providers and their own rising costs, providers are looking for higher increases, and you probably are seeing a lot of network changes or disruptions. So providers that might have been in your network before may not be in your network going forward, or you might see some temporary disruption as carriers and providers negotiate beyond the expiration of the contract. And so it's likely something that you'll continue to see in the near future. A lot of those negotiations do result in a negotiated price, and those providers might stay in the network, but there is going to be some disruption in the meantime. But despite all these costs going up, employers are really still expected to offer robust, flexible, comprehensive benefit package that offers more than just core benefits. And unfortunately for employers, they cannot push these costs onto employees. In the past, the increases might have been shared through employee contributions, increased deductibles, changing of plan designs, and it's harder and harder for employers to really push those costs onto employees. So we really want to look at what do employees value from their medical plans so that employers can continue to offer employees the benefits that they want and what they need. Because employee retention is really, kind of a key factor for almost all employers. It costs way more to hire a new employee than it does to keep them, employed. We look at, why do employees stay? And one of the top reasons that employees stay with a company is a competitive total rewards, including compensation and benefits. And the flip side of that is, why do they leave? Often they leave because of burnout and personal well-being and insufficient total rewards, including compensation and benefits. The other reasons that employees stay or leave, are not necessarily benefit driven, but so we want to focus on what we can advise on the benefit packages to make them more attractive for retaining employees. And so what we have found is, in addition to core benefits, the benefits that are really critical for benefits, or critical benefits for employers to offer. So one is every robust medical plan should include some mental health benefits beyond the core medical plan. So there should be some type of telemedicine that includes online therapy, access to mental health benefits beyond just through that medical plan. And that often includes also an EAP, and this can help with combating burnout, stress, and some of the substance abuse and mental illnesses. We are in a mental health crisis. It started before the pandemic, but the pandemic obviously exacerbated this, and it's really not, it's not getting better. And so it's really important that mental health benefits become a key part of any plan. The second thing is that employees are really looking for flexible work arrangements, and there's lots of different ways that they are looking for that. But employees are increasingly tasked with both not just their children, but also elderly caregiving roles, and having flexible work arrangements will allow employees to really meet these needs and, you know, better support their families in all the different ways. And so this is tied into the benefit packages, but want to make sure that that employers understand how critical these are to alleviate that mental stress and burnout as part of. And it's not always possible for employers in all industries to offer these flexible work arrangements, but as much as they can are very much appreciated by employees. And finally, voluntary benefits are not new. We've been talking about voluntary benefits for 30 years, but they still are highly valued by employees. They offer a meaningful way to add more value to a package without raising costs. Some of the most popular still are pet insurance, you know, lifestyle spending accounts, financial wellness planning, etc. So as we look at what type of plans and benefits an employer really needs to have in place, one thing to keep in mind is that, you know, you can no longer, you know, throw the kitchen sink at an employee. That you really want to make sure that when you're investing so much in your benefits, that the benefits that you're adding really are offering are really adding value. So it's really important to understand your group specific population and what they are looking for. And so we at Heffernan, we try and help and make sure that we are looking at the demographics of your population and really finding out whether your employees are located in urban or rural areas. Do they want access to more remote services or in person? And so if you are investing so much in these benefits, we want to make sure that you are personalizing those benefits. So what you're putting your money towards are actually adding value to that plan. So even though employees are offered benefits, 40% of Americans enrolled in insurance plans sponsored by their employers have reported delaying their health care because of cost concerns. And the three most types of delayed care are dental care, specialist care, and primary care. So even though an employee has been offered benefits and is enrolled in the plan, they may not actually be able to afford even the deductibles and coinsurance maximums that's there. So it's really critical to make sure that the benefit packages are being personalized so that there are options for employees so that they're not just insured, but they're getting the value out of the plans. The last focus of our trend report is really the growth of, you know, AI. It's in all sectors and everywhere, but there are ways that AI can improve benefits. AI can have a better understanding of the workforce. So in the effort to personalize a benefit package, AI is just a really fast search engine, and that will allow you to know what your makeup is of your population so that you understand really the healthcare needs of your group specific population. Decision-making tools when it comes to open enrollment have been around also for a while, but they've been limited in the past really for the scenarios that we think of. So an employee might have some children and they're expecting maybe to have at least 1 or 2 ER visits. But a AI can run through more scenarios than we can expect and really help guide an employee through that decision-making process. And so they can guide them to the plans that make the best sense for the employees. It's also very helpful for communicating and educating employees about their benefits. And all 3 of these ways that AI can help is a relief to the HR team so that they themselves can better personalize the experience for the employees. It frees them up to not answer simpler questions or provide some of that continuing education that can be more streamlined so that they can really be there when that personalization is really needed. So with that, I come really to a summary of what we're looking at is that 2025, unfortunately, is seeing a high prospective trend increase. We're looking at 9% nationally. Alternative funding solutions are increasing as a result of multi-year high increases, presenting more cost-saving solutions to employers. And really, specialty drugs are the driver, and especially GLP-1s and the number of new therapies that are coming onto the market, and making sure that members are aware that there might be more than one drug option out there for them. We feel that understanding the landscape of employee benefits are what employees want, and what is driving costs will help us really create a more robust benefit package. So I'm going to leave this summary up and really open it up to questions here.
Thank you, Jenny. That was a lot of information. And personally, I've recently experienced a change in my health insurance, and the prescription part just about blew me away of what my copay is now versus what it was, a year ago. So
right.
It's so frustrating, and I feel sorry for people that are on these life-saving drugs that, how you just wonder, how do they afford this? So we honestly don't have any questions. Somebody did ask if this presentation is going to be available to download, and we will have an email follow-up sent to you today with a link to the copy of the presentation. It was also recorded, so sometimes it takes up to 24 hours for that to appear on the site, but we will get those emails out today. And I appreciate you, Jenny, and all the information, and thank you all for attending today's webinar presented by Heffernan. We will send information, as I just explained, with instructions on how to access a copy of the presentation from our website. Thank you again, Jenny, for your time and expertise today. We hope all of the attendees found today's webinar to be a valuable use of your time. Be sure to join us on September 17th for our Managing Difficult Employees, 15 Types of Employees Who Challenge Us webinar. Thank you all and have a wonderful day.
Thank you.